Hello everyone, thanks for joining us here on Horizon. I'm Courtney May, filling in for Rob McClendon this week. The CDC reports that 7 out of 10 American deaths are the result of chronic illness, such as heart disease or cancer. And nearly half of U.S. adults have at least one preventable chronic illness. That makes prevention a key ingredient for healthy communities. So to look at how one rural hospital is addressing prevention, here's our Austin Moore.
Travel west on I-40, and in between the quiet places, you'll find the steady bustle of Clinton, Oklahoma. Surrounded by farming and ranching, this town has the calm, steady energy of a Sunday drive.
Small town communities are awesome.
Jody Williams is spending her retirement volunteering in Clinton.
We've got the Senior Citizen Center that's very, very active. You can find a group of 8 or 12 guys playing dominoes every day, and they've got a quilting group that's there. We've got the Route 66 Museum. We've got wonderful dining, faith-based churches on every corner, very active. But the rolling hills, the beautiful sunsets.
Another thing they have is an aging population.
We have more funerals than we have weddings. We've got older folks, and I'm now one of those seniors.
According to the Clinton Chamber of Commerce, where Oklahoma on whole has 13.2% of its population checking in at 65 or older, the number is 17.4% for this rural community, which makes healthcare a growth industry.
I'm a big believer that healthcare is best delivered locally.
Cameron Lewis is the CEO of Alliance Health Clinton, the local hospital.
Alliance Health Clinton is a 56-bed acute care facility here in western Oklahoma. We are in a rural area, but the number of services we offer is quite expansive for the size of facility we are.
It is fitting to find this facility in Clinton, which dubs itself the hub of western Oklahoma. This hospital acts as a focal point for a number of surrounding rural communities. Yet the need is still great. When you look at Oklahoma County, the state's most populous, there are roughly 40 physicians for every 10,000 people. But in Custer County, where the hospital lies, that number drops to 9 physicians for every 10,000. And in Ouachita County, which captures the southern tip of Clinton, 1.7. So before ambulances, before surgery, before chemo, and before joint replacement is prevention, which is a priority for the hospital and the community as reflected in a new monthly meeting for seniors.
This Senior Circle program that we've developed gives us the opportunity to have a platform to educate our community members who fall in the senior citizen age range about how to live an active lifestyle.
What we really try to do is get these patients to speak up and learn more so that they can better service their own needs and know what's out there and really attach themselves to those resources when they're needed.
Pam Wire works for Alliance Home Health and says the meeting offers information to the elder population, but also something more.
They need that interaction. It's part of becoming not physically strong, but emotionally strong. And I think that just providing that for them and an ability to say, hey, I know you have been in this position before, how did you get through it, is very important, almost like a support group. Having that is extremely vital in increasing their health.
And according to surgeon Tanis Fakhri, being out and about can give a glow to the golden years.
As you age, in general, you tend to be more sedentary. And that applies to males and females, especially when you're retired and you're not moving much. And so ultimately that's going to affect your lungs. You know, you're not using your lungs full capacity, especially if you're a smoker, and also your heart. So, you know, and your vessels too, because the more you use your vessels and your muscles, the better the blood flow to your organs is, and the more active and healthy your heart and lungs are.
When people are empowered with the opportunity to decide where and when and how they receive their health care, they're going to become an active participant in that decision and in that healing process, and it will, in the end, make them healthier and have a more active lifestyle.
In this part of the state, where neighbors are often separated by miles and the major hospitals of Oklahoma City can be hours away, Jody Williams is grateful for a local option.
The experts are here, and they're just a few steps away.
One of the unexpected benefits of the aging population in rural Oklahoma is the boom in healthcare jobs, which can help small-town kids find a career back home. We'll take a look at how this is happening when we return.